So you think that's a movement that will help us get healthier then? Going to, I mean, there's a couple companies that make pseudo meat, but Beyond Meats
Well,
and
I
those.
don't know that Beyond Meat is chemical. Chemical meat is not that much different from meat raised on the hoof.
You know, you read the label, Dr. Bone, you read the label, and you're right. It's so complicated and there's so much stuff in there. It kind of shies me away from even trying it, plus the price. But it doesn't look so healthy with all the chemicals in there. And
Well, again, at the end of it all, we are still the same bodies that were running around 10 or 50,000 years ago. And unless we feed it like it was designed to be fed, we're going to come up short. We might increase the amount of cash in circulation. We might create new cadres of billionaires or multimillionaires, but this would be at the expense of the individual.
I see. So, Dr. Bone, talk to me, please, about feeding the body the way it's designed to be fed, and the information you obviously share with your patients. You talk about this with your patients, I presume. And what do you say to them? What is feeding the body what they're designed to eat look like?
Eating like an 18th century, 17th century peasant.
Okay, it doesn't sound so charming, but
Well,
describe.
actually, when you look at it, what did poor people eat? Poor people ate roots, shoots, leaves, fruits.
Not a lot of meat.
Yeah, and occasionally, they will have some animal products. Chicken once a month. They would have an occasional sweetened beverage because they couldn't afford sugar. So now that since sugar became more available, all of the disease of over consumption of simple carbohydrates have become rampant.
It sounds so simple. So why are we having such a difficult time with it? We're back to promotion. We're back to advertisements. We're back to billboards.
Right.
Is that what it is?
And the thing about it is, when you now look at how the rich eat, that's how the rich eat.
Yeah. Yeah. Right. You have the vision in your mind. You're going back to what, 14th, 15th century of the king with that big drumstick in his mouth.
Yes.
And he's got this feast in front of him with all this meat and everything. And they had gout and they died of terrible diseases. But
rich people don't eat like that anymore. They eat greens. They eat very little processed foods. That's why it's called whole paycheck, whole foods.
Right. It's expensive to be healthy, right?
Well, it has been expensive to be healthy. It does not necessarily have to be that way.
Mm-hmm. And Dr. Ben, what do we do to get Whole Foods to Prince George's County? What do we do to get Wegmans? I know there's a big, beautiful one right near where your practice is. But is there anything we can do to get these food deserts not be food deserts? Is there any
actually, farmers markets, farm to food projects where farmers could deliver X boxes to a central area. That's one way of doing it. Using churches as coordinating centers for farmers markets would be an excellent start. And but just doing what patients can do themselves, which is first cutting out sweetened beverages, cutting out the orange juice, cutting out the drink, cutting out the soda, and treating them like delicacies, which they are.
It's interesting. We've talked about two things. We've talked about the system causing problems, but now we're talking about patients taking responsibility for their own lives, right?
Yes.
And so you're saying that there's a portion of this that we all have to accept responsibility for our own health. We have to step up and change our behavior and change our diets. So there's two pieces to this puzzle, one of which we're in control of ourselves, the other one not so much.
Well, that's a true statement. And the more you take control, the more control you have.
I see. And so is your message, and I've got a feeling your message has been the same for many, many years. How is it going over more so today than maybe 10, 15 years ago? Do you think folks are paying more attention to that holistic message that you just described?
They've always paid attention to it, and as they execute, they become healthier.
Well, that's an optimistic view. So that's what you're seeing in your practice. That's wonderful. Do you think your colleagues? I know you led a physician organization a few years ago. Are your colleagues saying the same things, or do you feel like you're a minority in with your peers? What's the rest of the industry saying about this? Because some of it is kind of revolutionary. You just don't hear it.
Well, the thing is, I don't know necessarily. That I know most physicians know this to be true. One, but whether or not they have the both the time and the inclination to spread it, like I do, is not necessarily true, because again, the system is not set up for you to be able to do this with the greatest of ease, because of the amount of time it takes. It just so happens that my view of medicine, which I tell my patients, I would like to keep you alive as long as possible. As long as you pay your bills, we will spread this out over 50 and 70 years as opposed to a few visits.
I see. That makes sense. So I guess it boils down to two big issues. One is a huge systemic issue that you and I are not going to fix, or a group of folks are not going to fix. So we'll have to just hope that that system evolves.
Well,
Right?
I would take issue with that. The system is made up of people, and you were not always a podcaster, and here you are now. So if we just touch and spread the message to one more person, the system can change.
Okay, point well
The
taken.
system will change.
Point well taken. Well, I appreciate your contribution in spreading the word, and then the other point that you make that's really, coming home, is to say, listen, at the end of the day, we are responsible for our own health, and there's things that we can do. We can stop drinking the juices. We can get more exercise. So it's about ourselves as well, and taking control of our lives. So maybe the combination of the two, we have hope for the future.
We do have hope for the future, and realize that we have made a lot of progress. We as a society have made a lot of progress. I remember that there was a time when, as a person of color or a poor individual, you were turned away from emergency rooms until EMTALA ruling came into being. So that 1970s, 1960s are not that far away.